Let's bring in Dr. Ashish Jha. He's Dean at Brown University School of Public Health. Dr. Jha, good morning. I do want to talk to you about this good news on the vaccine front. But unfortunately, we are seeing from coast to coast a lot of states having to go backwards, implement some of these lockdown measures. We're not seeing, and I don't think we will see, this national one-size-fits-all lockdown. But are states doing the right thing right now?
Yeah, good morning, and thank you for having me on. Some states are. I was really pleased to see the governor of Michigan lay out what I thought was a very sensible plan. I think California is moving in the right direction. What you don't need a national lockdown. What you need is targeted, focused efforts on the things that we know really are spreading the disease. And it's good to see some states doing it, and I wish other states would follow suit quickly. Waiting is not a good strategy at this point. Everybody needs to move fast.
There's just this feeling of helplessness because every single day the numbers just get worse. I mean, the positivity rate is going up, hospitalizations are going up, the deaths are going up, and it just feels like this forest fire that's raging out of control. Is it just masks? That's it? Masks and social distancing? That's all we can do?
Yeah. So first of all, we should not find ourselves at this position. Like, we're 10 months into this pandemic. Everybody knew this was coming. And again, our federal government just didn't prepare. In the last couple of months, it has decided to completely check out. And that's why the whole country is aflame. Certainly, masks are going to help. Certainly avoiding indoor gatherings, including, unfortunately, larger family gatherings at Thanksgiving and the holidays. And then I still think there's a lot more we can be doing on testing. Testing system is really getting strained. We've got to make that better for people so that we can figure out who's infected and who's not.
Can we just talk for a moment and get to brass tacks on Thanksgiving? Because, public health experts like yourself are saying, don't do Thanksgiving with your extended family. Stay in your old household. And anecdotally, I know a lot of families who are like, okay, but we'll just have grandma and grandpa. We'll just have brother and sister. We'll get tested. We can make it okay. Is that right? Can you make it okay? What is your fear about what's going to happen after Thanksgiving? If a lot of really well-meaning, good-hearted people think, I'll just tweak at the edges. I won't be irresponsible. I'm just going to tweak at the edges a little bit.
Yeah, no, I totally understand the sentiment. And Thanksgiving is a holiday that our family really enjoys, and we tend to have an extended family gathering. We're not doing it this year because I don't know how to tweak it enough to make it safe. And my elderly parents, for instance, who I usually see on Thanksgiving, we're not going to see them because I want them around in 2021. And I can't figure out how to make it safe for them and for our family. So I just think at this point, we're so close to a vaccine rollout. This is not the time to start making bad choices.
Let's talk about the vaccines. They do look really, really promising. Both of them over 90% effective, at least in this early data. What's the implication of that kind of success in a vaccine?
Yeah, first of all, it is terrific news. It's better than I was expecting, and I love to be wrong in this direction, right, when it turns out even better than I was expecting. What it means is that once vaccines are widely rolled out late winter, early spring, it'll make a dramatic difference on this pandemic. It won't completely go away, but it will be so much better than it is now that we'll be able to get much of our lives back.
We just got to hang on. Dr. Jha, thank you very much. We really appreciate it.